My name is Leslie Onion and I'm the Unit Head for Chemical Safety and Health at WHO headquarters in Geneva. Poison centres are an important priority. Historically, and still today, countries often start modestly with an information service that can respond and answer questions about the type of chemical exposure that has taken place.
Poison Control Centre Munich, hello, how can I help you? Okay. The PCCs answer many hundred calls a day, ranging from household exposures like cosmetic products and detergents, over pharmaceutical products, medicines and tablets, but also chemical products and natural poisonings like snakes, mushrooms and plants. Okay, take a deep breath and calm down. How many tablets did your son take? Okay. And can you tell me how old he is, please? Just 14 months, okay. Hi, my name is Katrin Romanek. I'm a doctor for internal medicine and clinical toxicology, and I'm here to tell you a little bit about the importance of poison control centres. In order to provide high-quality consultations, it is very important to rely on databases. These databases need to be up to date in order to detect patterns of change and frequency of intoxications. This is called pharmacovigilance. By working together with other institutions like Federal Bureau of Risk Assessment and other PCCs, we can detect early patterns in poisoning. This is essential for immediate risk prevention. A recent example would be the addition of child protective packaging on detergent pods and also the increase of size to minimize ingestion by children.
From these beginnings, a poison centre can evolve to become a core unit in the public health management and response to chemical emergencies and can assist countries to implement the international health regulations.
Hello, I'm Lucia Scharz, toxicologist and international instructor in major incidents and disasters. I will outline roles that poison control centers play in preparing for and responding to chemical incidents based on our national experience. PCC collaborate at national level to develop guidelines and standard operating procedures, protocols for emergency medical teams for response in chemical incidents. They also participate in planning procurement of personal protective equipment and antidotes. To ensure national capacities for response in chemical incidents or mass poisonings, PCs prepare trainings and education program for first responders with focus on recognition of hazard, use of PPE and treatment of exposed persons. During chemical incidents, the PCs can provide information and consultation about risk assessment, protective measures, decontamination procedure, triage priorities, treatment of casualties, including antidote use. After chemical incidents, PCs are involved in analysis to assess if chemical incidents management mitigated health risks effectively and timely. PCC play a pivotal role in preparing and response to chemical incidents and mass poisonings.
With the day-to-day experience of advising on chemicals management, a poison centre can accumulate and establish a repository of information about the chemicals used in their countries. These registers then become extremely valuable in assisting with chemical risk assessment and risk management decisions in a country.
Managing in excessive effort we put into poisoning prevention, so people know what to do if something happens, how to recognize the dangerous parts in life.
Is a service that works in urgency 24 hours a day and 7 days per week, work together with institutions.
It's a place where people can call. They receive reliable information on a scientific basis. We help in unusual poisonings, incidents, mass breakouts, coordinating national activities.
An establishment that optimises the care of someone who's been exposed to a potentially harmful substance, whether that's a pharmaceutical, a recreational drug of misuse, or a natural toxin, whether that's a plant or an animal sting.
Collected the request from both physicians and patients themselves and sent antidote to hospital for treat patients.
Specialized units to treat poison victims. Surveillance and alerting, and the timely provision of public health advice.
Provide risk assessment in each individual case and very specific treatment advice for the medical doctors.
A poison center also has a very important public health role. So with regards to chemical safety, with regards to toxicosurveillance, so help decision makers with regards to safety of pharmaceuticals, of chemicals, to anything which is toxic.
It's an institution that gathers data to improve the general health care.
Well placed at playing wider roles, even in things such as contribution with public health changes in legislation, trends in chemical safety and product safety, education of not just healthcare professionals, but even the wider public.
It's an entity providing a service to the ones in need. Most important, in my view, is that the knowledge is available within the infrastructure.
This service decreases mortality and saves lives.
Poisonings are a matter of public health concern.
WHO has established comprehensive guidelines and activities to assist countries to establish this vital chemicals management service. All countries need access to a poison centre.